how can we make care more intelligent without making it less human? Using AI and leveraging AI should not be a license to add more to people's plates. Because if we're going to say, oh, we're giving you AI to simplify processes for you, and at the same time, here is more 30 tasks that you should do instead, now that we cleared your plate off, that is not responsible AI. People have been struggling with burnout, being overwhelmed, being overtasked, underappreciated, even maybe underpaid.
Let's talk about one of the most important questions at the edge of human and AI. How do we make care more intelligent without making it less human? This is The Edge of Human and AI, a Viva la Coaching podcast. We sit right where coaching meets AI, and we're not afraid to ask the uncomfortable questions. We built this show because the coaching landscape is being reshaped by intelligent systems, and the organizations, leaders, and companies shaping that future deserve honest conversations. I'm your host, Rebecca Rutschmann. Each week, we'll help you understand how AI is transforming coaching. We discuss leadership development and human growth across organizations. We will help you navigate the ethical and strategic decisions that come with bringing AI into the coaching space. You'll hear from researchers, innovators, and industry leaders, as well as experts who are reimagining what's possible. Whether you're navigating AI for the first time or already building with it, this is where you belong. Follow us now and join us at vivalacoaching.com. Come stand with us at the edge. We're starting our podcast with a special season from the leading voices of the NYU Coaching and Technology Summit 2026. We will bring you bold, unfiltered conversations at the frontier where coaching meets technology and artificial intelligence. Expect real talk, sharp minds, and unfiltered conversations where we dare to ask the difficult questions. I have a great guest today, Dr. Moain Abu Dabrh, Associate Professor of Medicine at Mayo Clinic, board-certified health and wellness coach, board member of the National Board for Health and Wellness Coaching, and what he calls a medical humanist, someone who believes that medicine is not just a technical mission, it is a human encounter. He sits at the intersection of evidence-informed care, behavior change, and technology, and he has spent his career asking how we see the person beyond the diagnosis. We'll discover why he sees AI in healthcare as simultaneously the greatest opportunity and the most carefully managed risk in any profession. We will hear his 4 concerns about where AI could go wrong and the one that worries him most. And we'll explore why, in a world that keeps asking whether AI can replace us, he finds hope, not in what the technology can do, but in the questions humanity is finally starting to ask. Hello, Moain. It's absolutely great meeting you today and having you for this interview.
Thank you, Rebecca. Great to be with you.
And just to give a little bit of a heads up to our listeners, what do you think they should really know about you and what drives you?
That's a great loaded first question.
Yes.
From a professional point of view, my work sits at the intersection of evidence-informed care, understanding the human capacity, behavior change, and sprinkled with technology. Always the question that I keep asking myself professionally is, how can we make care more intelligent without making it less human?
That's wonderful. And what is it about this space that got under your skin and never let it go?
It really started early, having a conversation with my parents. I was in high school at that point, back in Tripoli, Libya, and we always have these conversations around. My father studied sports psychology and physiology, and my mother is a teacher. And my dad switched kind of his career involved into the business side. So we always have conversations that are rich and diverse. And one of the questions that came up is, all right, you're at high school. What would you like to do at the beginning of your career? And then my mother, being the teacher, said, well, what would you like to do with the rest of your life? Like, oh,
that's a big question.
That's a big question for a high schooler. But it really opened the door for me to start to think about, what do I want to do? From a study point of view, I was never really the kid that had a clear idea about what I want to do professionally. I knew that I wanted to do something that would be helpful in terms of interacting with people. I didn't want, quote unquote, routine structure. I thrive on the idea of things are changing and exciting every day for me. Some people want the routine, and I think that's wonderful as well. And at the same time, I just wanted to do something that is contributing, that would add value. So I just was looking into that. And one day, as we were having this conversation, they said, well, what do you want the intersection between your personal and professional life? And we arrived to that moment of saying, you have to find intention in what you do, compassion for what and who you serve, and then really try to make it somewhat enjoyable. And it will be perfect if it's even more fun. So that gradually drove me a little bit towards healthcare. And maybe it was more of a conversation with my dad who guilted me into going in healthcare. But it was one of the best things that I've done in my life. And just my career evolved from there.
Thank you. And I think it's so meaningful now to be in care as a profession.
Yes, that word is so powerful, whether we do it through the clinical work, the research work, the coaching work, volunteer, community. There are so many forms of sharing and giving and providing care. And I had the privilege of experiencing a little bit of different things so far. So I really feel fortunate.
Also caring about each other, I find, is in that word care.
Ooh, yeah.
I think it has such a beautiful meaning. And you describe yourself, and I read that, as a medical humanist.
Yeah.
What does that mean to you? Tell me more.
Yeah, so that was really a term that I want to give the credit where the credit is due. That started somewhat a few years ago, but then one of the wonderful people at TED, as in the TED Talks and specifically TEDx, as we were discussing my idea to do the talk, I said, healthcare is humanism. So they said, well, you're a medical humanist. So I said, yes, that is really exactly what describes my work, because it means that remembering that the mission of medicine and healthcare is not only technical, it's not healing the sick, it is a human encounter, and that it asks us to see the person beyond the diagnosis, the work that a person takes on to take care of themselves, whether it's to care for their overall well-being, for their condition, and the dignity that needs to be embedded as part of every clinical and healthcare decision that we make to support them. So that framing really matters to me, because we live at a time where healthcare systems, not only just in the United States, but all over the world, are facing a pivotal point where we need to make sure that we take what used to be good, and that is the art of healing, and ensure that we are continuing to move it forward, that healthcare, that the mission of well-being altogether is truly human-centered. And now we are at the age of technology, and specifically AI, that this is a new frontier and new endeavor that we have to be exceptionally careful and thoughtful about it.
I love that you started mentioning AI. That's my sweet spot. But with technology arriving and of course, AI entering the picture as well, there is a lot of things that maybe the technology can support or take the load off some of what the humans do. My mom has been a nurse, a practitioner as well. She taught actually at the school. And I saw on how difficult it is to carve out that time with the patients. Even more difficult for the doctors. The nurse practitioners have closer contact. But do you see any potential with technology and AI arriving in that space to maybe get back some of that time to really then spend on the human care side again?
Yeah, that is a great question. And I want to send thanks to your mother. And the mission of nursing is one of the most important and valued portions of supporting people in healthcare. So shout out to all of our nurses. When I think about AI, I think there is great excitement, and with that comes a lot of cautious optimism and maybe a little bit even concern. And my concern is that innovation can widen or worsen different fronts in healthcare. I think about specifically four different things. The first one is, are we going to dehumanize medicine if we make technology overly front and center? So there is that unknown about that, is how can we keep medicine and how can we keep everything, not just medicine, I should say, every profession still human-centered? So we have to think about that. The second part is the confidence or the overconfidence that comes with utilizing AI and technology. Are we relying too much on it? Are we examining it rigorously to make sure that information is not only correct, but it's also appropriate and contextual? The third concern for me is inequity. There is still considerable risk that AI might be prone to favor certain outcomes, certain individuals, certain races. So there is a lot that we need to be careful about in thinking about the cores of that. Anything we deliver through AI supports all. And the fourth one is the unknown. And the fourth one is the one that really worries me the most, which is there's a lot of uncertainty about the guidelines and how are we going to regulate. So regulation. And that is not going to happen anytime soon. And these are maybe more geopolitical conditions and the race for the best and most powerful. That is maybe the part that worries me the most, is how are we going to ensure that we can regulate AI, that it will still work within ethical and responsible boundaries? Those are the concerns. With your question, when you said, how could it be helpful? Absolutely, it's going to be helpful. It is already helpful. I mean, there are amazing things. There are different levels of bounties that we are reaping already, be it on the diagnostic front, be it on the prognostic front, be it on the approach, easing the administrative and clerical work, streamlining processes, simplifying things. There's so much to do. And in healthcare specifically, maybe I can give this example in this world. I want us to be careful that using AI, and this does not even apply to healthcare only, so I should say in every profession, using AI and leveraging AI should not be a license to add more to people's plates. Because if we're going to say, oh, we're giving you AI to simplify processes for you, and at the same time, here is more 30 tasks that you should do instead, now that we cleared your plate off, that is not responsible AI. People have been struggling with burnout, being overwhelmed, being overtasked, underappreciated, even maybe underpaid. So we have to be careful that what we are minimizing and removing in terms of hurdles and challenges should be replaced with more opportunities for people to take care of themselves, professionally grow, and personally feel better.
And I love that, because the well-being of the caretakers should be at the forefront, because I don't know how it is in the US, but here, a lot of them left their jobs. They're doing something else, or they're burnt out. They went on 80% and work less hours because they simply can't do it anymore. We have a huge shortage, and I think it's probably the same for you as well. And with the addition of administrative tasks over the last year, having to learn new technologies even in the workplace, they're also overwhelmed. This comes all on top of what they have to do. So my hope is always that with new technology arriving and they may be learning, that we can create more space or more time for them to look after themselves. If you don't look after yourself, you can't look after others.
Indeed, beautifully said. And burnout is a pandemic at this point. The same trends have been happening for the last 2 decades, especially. And yes, some people may argue that certain things have eased up a little bit, and maybe it was more pronounced during the COVID-19 pandemic. The COVID-19 pandemic has taught us some lessons, and we should learn from it to be better. And I hope that we have learned. I am cautiously optimistic, but now that we are at this pivotal point of AI and how it's going to be leveraged, I remain concerned about that. So I'm hoping that we will continue to be responsible about supporting people's personal well-being as much as their professional growth and endeavors.
Do you see any space where people like you and others from your industry can really shape that or support shaping that from a more governance side?
That's the hope, but I love that you brought up the governance component, because it is not and should not be only the mission or sometimes the burden put on individuals. It should be systems, it should be policymakers, it should be the higher and more responsible leaders. I think from the research that we see, especially around burnout, we often think about that we should provide interventions that are directed towards the individual. And yes, those can be helpful and they should be available for people to support their personal well-being. But unless we change the systems, that is going to continue to exist. We are just putting a Band-Aid. So your word governance is important. It's the larger umbrella. It's the policies. It's the system overall that needs to be changed and adjusted and adapted. In the United States, I would argue we have a system that is archaic on some levels. We do a lot of things nicely and beautifully, and I think people always would like to come from good intentions in how to improve outcomes. We have amazing discoveries and wonderful healthcare professionals who come in with a sense of mission. And we have to adapt the systems and the policies to ensure that it goes hand in hand with the change of times.
So how important are associations like the National Board for Health and Wellness Coaching, for example, in that picture?
I think every governance body in every profession needs to support that mission. And already, I think, be it depends on the type of body. Obviously, credentialing bodies are different from societies, different from associations. And that's important. Nonetheless, it is ensuring if you're a credentialing body, then it's the mission of how you are building the profession to ensure that your education matches the needs, matches demands, matches the mission that you're trying to support. If you are a society, if you're an association, an entity, whatever the title is, then it's how do you want to build academically the science, the profession, the practice, the scopes. Those are important. And within the national board, wearing my hat there, I would say that this has been truly the mission that we embody, is that where we can support everyone to be the best version of themselves. So that's what health and wellness coaches are endeavoring to do, working on their own and supporting and being part of the bigger picture with others.
How important do you see the role of health and wellness coaches in the future, also when we look at the care side of things?
I can't emphasize enough how important it is. And this is not a personal testament or opinion. This is what the science is showing. One of the major opportunities that we can support, and I can talk maybe from the healthcare point of view, and that extends to a lot of professions, is that in healthcare, we've made leaps and bounds ahead. We have amazing technologies, discoveries, medications, devices, and so forth. And health outcomes continue to be somewhat lagging or unmatching to those amazing discoveries. And the part that we keep missing or not emphasizing on enough is the care needs to be about the person, not the condition, not the quote unquote disease. And that healthcare systems really, truly need to move towards what is now known as whole person care. It's about the whole person. We don't come just with a condition. We come with our own stories. We come with our own presence, be it a person who is working, part of a family, doing this, doing that. And that condition is just a component. In providing care that is whole person, we need to focus on how can we support the behavior change? How can we empower people to take leadership, autonomous role in supporting themselves, be it from self-care to healthcare to all aspects of well-being. And that is the role that coaches are providing and supporting and should be as an integral part, is that they are the missing link where the patient understands or the person understands their needs within the healthcare system, but also we help them identify and integrate what matters to them on the personal well-being, and then really nicely finding the right way to how we can integrate those together and ensuring that the person is moving forward in living their best life as they hope for. And coaches are the right people who are trained and equipped to take on that and support that. And that's what we strive and we have been doing for the last decade or so through the National Board for Health and Wellness Coaching, is creating the golden standard and the rigorous training for coaches to be equipped and work in different healthcare, well-being, and wellness settings.
Currently, these type of jobs are still, for many people, probably still a luxury because you have to pay for them for yourself. And you also work a lot with more vulnerable and, underserved populations as well. What are your best hopes for reaching them more through coaches, through other support? We know, like you're sick, you go to the hospital, you're healed in the eye of the hospital, you're released. Like you say, the whole person approach, you go back into your life, you fall into the same patterns.
Yeah.
You usually see these patients then in different sequences again over their lifetimes. And what are your best hopes for maybe changing something there?
The reimbursement component is a major thing, and we have acknowledged that, and we have been working through the National Board. We have been working diligently to ensure that we can move that forward. And this is a partnership with so many wonderful people and healthcare systems and organizations and employers and so forth. So we are really grateful, over 100 partners on this mission. The National Board for Health and Wellness Coaching, NBHWC, has led the efforts and worked with some entities, including some of the work that the Veterans Affairs have done beautifully in making the case that health and wellness coaching should be a reimbursable service, and specifically in healthcare. And maybe for some of the audience that are not familiar, there is a coding system that services in healthcare that when you put a certain code that matches a service, a diagnosis, then you get reimbursed. And of course, that is one of the most complex systems. But in 2019, we made a major feat where health and wellness coaching was categorized as a Category 3 service, which means that it is a somewhat novel, innovative service that should be assessed further and considered for reimbursement. And then since then, we continued this work with other partners in supporting moving that to what we would call Category 1, which is more reimbursable by different payers in healthcare systems and employers and so forth. The work continues. We have made significant strides. We have worked diligently. The evidence is clear about how health and wellness coaching is impactful. It is now an integrated or a standalone service in many healthcare systems, wellness programs, employers' services, and it exists in many different settings. So that has been really a major advancement in the field. We are at a moment that we're hoping that this will translate to more permanent reimbursement. There are different pathways to getting reimbursed, and maybe I would encourage people to look up these pathways on the National Board website, nbhwc.org, and to explore that. Yes, in many ways, it might be still a self-pay service, but we have seen more and more private payers, more other reimbursement pathways that are happening now. And it varies sometimes by state, by system, by healthcare plan. So that is still work in progress. We have made extensive work and we've had meetings with the Center for Medicare and Medicaid Services, CMS, in the United States here. And we are hoping that this work will continue to yield positive outcomes in terms of permanent reimbursement in the near future.
Just imagine that potential. Leadership coaching is something that we do for a very long time. So it has been well established. You can do your master's degree in that. But I love that more and more education programs are picking up on educating people also in health and wellness coaching. And I think that that's a great step, but it requires different skills because you also deal with a different group of people than you would do in executive or leadership coaching.
Yeah, that's a great point. I mean, leadership and executive coaching is such a well-established profession. And I would argue I've always, in doing the training and working with incredible coaches, always for me, the missing link or the great opportunity for that field to continue to even grow further is to bring health and wellness coaching. Because I would argue the best leaders are the quote unquote healthy leaders in the sense of that they are taking care of their own health and well-being and understanding how important that is, because then they become role models. They make sure that is an integral part of the culture where they are working, where they are leading, where they are supporting. There's a lot to be said about that. So when we empower leaders, when we empower people who are managers supporting other groups to understand the value of health and wellness, their own personal health and wellness, and make it a cultural prerequisite, if I may say, that changes everything. I've been really excited in seeing that collaboration, that attention, that movement towards bringing these different forms of coaching closer to learn from each other and understand more where we can grow together.
And I love it. I think that there's so much potential out there because, I mean, like, why do maybe leaders fail? Because they're burned out. It's like they can't anymore.
Yes.
They always focus on its performance, or it has been in the past. And I think there's a growing awareness that the well-being, the mental health is a very important part of being functional as well and performing well. And in the past, they just like pushed themselves very hard. Maybe there's a different thinking now around these things because people also want to live longer. So the whole longevity thing pushed that probably as well, that people think more about how to take care of themselves and learn more about this, and then hopefully also take more care about the people that work with them and for them.
That's beautifully said. And we want to make sure that everyone knows that everyone is an agent of change. This is not and should not and will not be limited to just if you are, quote unquote, a leader or a manager or an executive or anything. Everyone is an agent of change and everyone should be offered this opportunity. I sometimes argue a little bit, and I say this with a chuckle to dismay of some of my colleagues, and where I say, not everyone needs coaching, but everyone needs some coaching at some point, be it leadership, executive, health and wellness coaching, and so forth. It doesn't matter. We all grow and learn all the time. So it is important, especially for our listeners, to recognize that this is something that we want for everyone and everybody to take care of themselves, to feel the support. And how wonderful it is when you have someone that you look up to, someone who is leading, quote unquote, the work or the organization, that they lead by example with that. That is inspirational. So we try to capitalize on the power of that, but it's, of course, not limited just to certain people.
This can be a good call out for everybody, just to first look after themselves and then lead by example on what's good for you. Might be also good for the people around you.
Yeah. And for leaders to be agents of change, we have to, just what, quote unquote, has been the status quo, we have to unquote the status.
Yes.
We have been way too comfortable in what we said. Yeah, but this works. Well, evidence shows that it does not work.
It didn't work. Yeah.
We just let it be. So I'm excited about a lot of things. I am also optimistic about the younger generations, how they are more thoughtful and paying attention to personal well-being, and that they are looking into that being part of their professional growth and future. And that is not to say a generation is better or different than, no, it's how all of us can bring all of these great ideas and find where center is, center that works for hopefully everyone. And then we tailor it to the people, to the profession, and so forth. So I remain optimistic on that level.
I love that, because a lot of people always say, oh, the new generation, they don't really care. But I don't see that either. Or like they have all these things that they say about Gen Z. But then now there's, what is it now? Gen Alpha.
Yes.
I think my kids are growing into this. And I think they really do care. And I'm always surprised on how they talk to each other, also with great coaching skills, how we would identify it maybe on a totally different level than people would have interacted with each other when I went to school with 14 and 15.
let's be honest, every generation when they emerge, they get their own
label
critique load of, I remember growing up, I was described, our generation, oh, you are this and you're not like us. And we worked harder and so forth.
We need to put people in boxes.
Right?
Our group's always better than the other.
We like to label people because it makes it easier for us to think. And that's really, it widens the generational divide. And we should think about what have we learned from prior generations and times, what has worked, what could be improved, and what we should ditch altogether. And then have a conversation. We should have a conversation across the generations. This is not one generation or one person or a certain cohort's mission. This is all of us. I mean, there's no alternative.
Yeah, and I love that you pointed that out, because I think that new generations bring so much to the picture, and we can learn so much by just observing and listening to what they have to say and how they see the world, because they grow up in a world that has never known AI or technology. I mean, I'm the generation Golf, what we say here in Germany, because maybe Volkswagen was really big.
I love that.
And funny as my husband's first car was a Golf. Big laughing here. But yeah, you get these labels as well. I've never driven a Golf myself, but
I did.
You did?
Yeah, yes, I did. Yes.
So you're also around generation Golf?
Yes, I did. I grew up with that. There's a sense of duty to the next generations that every generation before, we ought to think about that. We have to make sure that we are leaving a legacy that would make this world a better place. That is a responsibility, and we should all take it seriously. This is an inflection point that we have to step back and look around and say, all right, what are we doing right now that will make this world a better place for the next generation, for our kids, for our friends, for our families, for our animals, for our planet, everything. So this is important. And no matter what profession we are in, we are all going to contribute. And I love that health and wellness coaching is one of those fields that is important to contribute to that. Leadership and executive coaching, those are professions of change, truly. So that is a responsibility. We have to take it seriously.
And I love to see how the mental health and wellness coaching is actually right. Like you see the growth throughout the last years and the attention. And I think it's a very interesting space to look at and to watch. And I'm very excited about this.
Yeah, thank you.
So I'm very excited about how that's going to be playing out on day 2 of the conference as well.
Yeah, thank you. Looking forward to that.
So I have another question that goes in a bit of a different direction. I mean, our kids here are building robots now too. They will become parts of our life in one way or the other.
Amazing.
And then I still remember the AI pioneer. I don't know if you heard of Geoffrey Hinton. He was called the godfather of AI.
Mm-hmm. Yes.
2016, he famously stated, I don't know if you remember that deep learning would outperform humans in medical imaging, and suggesting that we should stop training new radiologists. I'd be curious, do you still have radiologists at Mayo Clinic?
Proudly, yes. I have so much respect for my colleagues and everyone who is in this healthcare mission. That is a statement that I think is the not just million, maybe over $1 trillion question, right? And that does not obviously focus on just one profession or one specialty or subspecialty. Is AI, quote unquote, going to replace humans altogether? And I go back to my first comments about what concerns me about AI, and especially the one that is about what regulations and guidelines are we going to think about and have to implement to ensure that as we are continuing to grow and advance and expand this technology, if that is needed and where and when there's need for that, that we have to make sure that it does not indignify or minimize or dehumanize people. I often hear people say, oh no, AI is going to, quote unquote, augment or support. I am not that optimistic if we are not going to be clear about how we are going to regulate that. I do have concerns. I'm not being a pessimist. I'm being pragmatic and realist here. We have to really pay attention to how we are going to implement this, because in healthcare, there are alliances that have been formed to ensure that AI is being used responsibly. And that is continuing to be work in progress. So I feel that in healthcare, it's actually one of the fields that is more advanced in terms of how we are trying to, quote unquote, control it and ensure that it is used responsibly.
Also the most risky area when it comes to people's health and personal health data as well.
Exactly. Because there's so much at stake here. We're talking about human lives. We're talking about quality of life. So we are and we have to be responsible. That is not to say other professions are not, but that's the opportunity. So the honest answer is we don't know yet. We cannot for sure, or even with any form of certainty, say that AI is not going to replace this or that. It's unknown. It's something that is unfolding. And we just have to be proactive on the individual level, on the system level, on the global level, to make sure that we're not letting this go unharnessed and without ethical and responsible guidelines in place.
I just met a radiologist, so I think they're still there.
Yeah, no, they are. They are.
And they still need to talk to people about what they see and then interact with the doctors. And I don't think it's going to eliminate a lot of things. I'm more of an optimist here because I think it takes over tasks, not jobs.
At Mayo Clinic, we've made it a mission that AI is being used responsibly to augment and support and lift the mission of healthcare delivery, to support patient outcomes, to ensure that it is going to improve responsibly. And I'm proud to be part of that mission and part of an organization that really looks thoughtfully and carefully about that. And others are doing and trying to do the same. And we need to ensure that we're holding everyone accountable universally about that.
Because it can be also really good outcome. I mean, the question is not will it, but could it? And then should it?
There's a lot of work that has, as of now, and I mean, so much is happening, but there are a lot of trials that have been showing the impact of how AI is improving diagnostic, prognostic values, and so forth. So there is no denial of that. It's just a matter of to what extent and what forms and what degrees and how it's going to be implemented. That remains to be seen.
Yeah. I've been to the European Chatbot Conference last year, and they have like a robotics lab that we went in, like a forum where they built a lot of also social robots and robots, especially for care and home care, for ongoing patient care when they go back home. And I thought this was totally impressive because, I mean, there is not enough people out there looking after patients when they go home or even in the hospital. Or they had these tiny little robots that were very fluffy and they would purr like a cat, and they would calm people down when they get anxious. You could just kind of like hold them and you could see how the heart rate was going down.
Yeah.
And I'm like, wow, there's so much potential out there because there's not always a person around. I remember my grandma, she lived at home until the age of 92 alone, and she had someone coming in twice a day, but in between she was alone. So she had this button that you can press, but...
That's a great example. That is a point of debate and argument, right? Is how are we going to use AI or technology altogether? Because the idea of chatbots and mHealth and all of these things, these are not necessarily novel or new. AI takes it to a whole other level, especially when we're talking about not only just, the different large language models that are being used and now agentic AI, and now AI is taking that kind of those steps. But to your point, if we are going to make a blank statement and saying, no, we shouldn't use AI, quote unquote, dolls to alleviate a person's anxiety or loneliness, well, what is the alternative? We're not going to be able to bring 100,000 people at different hospitals to stay with every patient every night. That's not feasible. So we have to be careful and thoughtful about what can we fill in terms of gaps while not dehumanizing. I always give the example of the argument about organic foods. And I know some of my colleagues and friends, they're going to say, oh, don't you minimize the value of organic food? Organic food, yes. Is that a thing that we would love for everyone to have access to and, responsible and ethical farming and so forth? Yes. At the same time, it takes so much effort and work to move towards universal organic farming. Well, until that is happening, we still have to try to find still healthy and responsible ways that may not follow an exact framework that can still produce food to feed people who are hungry, who are not hungry. They are dealing with famine. If you are dealing with someone at a place of famine and atrocities and so forth, do we think that they're going to say, is this organic or not? That's an ethical question. And I'm not proposing for this or that. I'm just saying there's a lot to be considered here. Where and how can we use things ethically, responsibly, thoughtfully, and at the same time to ensure that we're covering some gaps as long as we keep humanism and belonging and justice and fairness part of the equation. I think those are great things to start from.
As long as and just. So it's a big thing that we're talking about here.
Yeah.
But if we keep it at our heart and try to, like with every decision we make, think about that in the equation as well, I think we can do little steps. And if 1,000 of us do little steps, we have already 1,000 little steps.
That's the foundation, right? Those are the non-negotiables. So it's important that we define the moral compass of our mission. And I think there are so many wonderful people and entities and organizations across the globe that are doing an amazing work and now integrating and studying and researching in AI and trying to achieve that mission. So I'm excited about that.
There's a lot of things that you keep space for in your head and in your thinking. I know that for a lot of people, what's happening now with technology, workplaces are changing. There's a constant change ahead of us, and it feels very overwhelming for a lot of people. And holding all these topics for you in your head must be sometimes quite difficult too. So what do you do to stay sane?
Well, I appreciate that you're giving me too much credit. I think everyone is trying to understand and learn and catch up. It's a very rapidly spinning world these days. And by the time we learn about something, it suddenly becomes dated. So there is a sense of unease, maybe an anxiety, maybe fear that we should recognize and we should honor. For me personally, really, as I'm thinking about the future, I have to also stay in the moment because there's no future without the moment, the current moment. So I find many things that bring me a sense of contentment, gratitude, cultivate my resilience, and just say, okay, I have to go through the thought and not spiral within it. So there are many things. Personally, I enjoy doing my hobbies, be it playing tennis, reading, spending time with my family, finding a source of inspiration from my faith, and things that are not different from everyone else and what they do. I think the beauty is that we all have our unique experiences and the shared experiences. So it's just to come back to those and finding the privilege of tapping into those resources. I don't take it for granted. And I just try to remind myself one day at a time, as cliche as that might sound.
It's not cliche. I just had to remind myself this morning. It's like, there's all these things I want to do today and all these things, and then the news come in and then this happened in AI and that. And I'm kind of like, okay, Rebecca, just say grounded now. Do one thing. Because if you do one thing, like I said before, one thing a day, you do 365 things a year. And I can't do everything in that one day. Otherwise, I'm going bananas now.
Exactly. And, we're all different. And some people are able to do one thing at a time. And some people are capable of doing 5 things at a time. Good for you. It's just finding what fills our cups and hopefully keeping a sense of meaning and intention and responsibility about not just ourselves, but also our surroundings, the people around us, the community around us, and so forth.
Thank you so much. Is there one thing that comes to your mind before we unfortunately have to close the session that you would like to share still with our listeners?
Well, first of all, thank you so much. The conversation with you is really thoughtful and wonderful, and your energy, your work. I had the privilege of meeting you couple of times and learning about your work and what you do is inspirational, is meaningful, is powerful. And I appreciate you. I appreciate everything you do. And thank you for giving me the opportunity to share this space with you. If there is one thing that maybe I think about and gives me hope, it is that these days I feel that we're asking better questions than we used to. That gives me a lot of hope, is that we are not just taking things for granted. We're not asking about, can we do this? But it's more about, should we do this? For whom? Under what circumstances and safeguards? And with what impact to us personally, to our communities, to our planet, the human life? So if we can think about the future, and what I hope for the future is that it's not technology-centered, that it remains human-centered, because we're the reason, as selfish as that might sound, but we are the ones with the mind, intelligence, and soul. And we have to make wiser, responsible decisions. So my hope remains that we keep that front and center as we think about the future and the technologies and all the things that we can leverage to make our lives better.
And stay human.
That's the center. That's the core.
Thank you so much for that conversation. It was absolutely beautiful.
Thank you, Rebecca. I appreciate you.
Moain said something near the end that I'm still sitting with. He said, what gives him hope is that we are asking better questions than we used to. Not, can we do this, but should we? For whom? Under what circumstances? And with what impact on us, on our communities, on the planet, and on human life? The question has changed. And that, he said, is everything. So the one I want to leave you with, what is the better question you haven't asked yet? That's it for today's episode of The Edge of Human and AI, a Viva la Coaching podcast. If this conversation opens something up for you, the best thing you can do is share it. Send it to a colleague, a client, a fellow coach, anyone who's asking the same questions you are. The more of us standing at this edge, the better the conversation gets. Follow us on your favorite podcast app so you never miss an episode. And come find us at vivalacoaching.com, where you'll find resources, community, and conversations you won't find anywhere else. We'll be back next week with another voice from the edge. Until then, come stand with us at the edge.